Under Montana's vast big sky, delicate wildflowers and majestic elk stand in perfect contrast to rolling hills and prairie rivers. And many unique opportunities await the physician and healthcare professionals who want to practice high-quality medicine in an area where the lifestyle is uncomplicated and friendly. Glasgow, Montana, a regional trade center where wheat and cattle provide a stable economic base for the nearly 8,000 residents of Valley County and 23,000 others in surrounding areas. People in Northeast Montana value integrity and have high expectations for quality health care. Francis Mahon Deaconess Hospital strives to meet the challenge.
I think we're very fortunate in northeastern Montana to have this facility. The community has worked very hard and been very generous. They do everything they can to support the hospital in terms of volunteer effort and time and in terms of dollar contributions.
The medical complex includes a 48-bed hospital and an attached medical arts building. Ongoing improvements outlined in our long-range master plan help us respond to growing patient needs with progressive services. Practicing in a rural area that covers over 15,000 square miles, we know the value of collaboration. Specialists in urology and otolaryngology, who recently joined the full-time medical staff, have expanded surgical services.
As far as our outreach clinics are concerned, we bring ultrasound and cystoscopy and prostate biopsy and basically the diagnosis and treatment of most urologic disorders out into the community.
Other than the very complicated vascular surgeries or surgeries requiring a large amount of blood supply, we can do pretty much everything. We have a very well-equipped operating room, well-trained OR personnel, and good anesthesia staff, so I feel comfortable tackling a wide range of things here. I never had lived in a small town until I came here. The big thing you have here is both an asset and perhaps a little bit of a change, and that's that you're not anonymous. People know who you are. You fit as part of the community instead of being added onto it or separate from it.
A couple of things that really attracted me here. Number one was I found on the medical staff people who were certainly not parochial, people from Salt Lake, from Southern California, from Oregon, from Denver, from Dallas, from New York, all of whom were exceptionally well qualified and lived in a small town because they wanted to live in a small town and really enjoyed the practice of medicine in a small town.
In this area, physicians can come in and practice medicine, and they can practice the medicine that they're trained for. Our board is committed to ensuring that the physician's needs are met, that they have the necessary equipment, they have the necessary environment that they can practice high-quality medicine in. The physicians coming into Glasgow know that they're going to be working in a quality care environment, a facility that prides itself in keeping up with technology and providing state-of-the-art medical equipment to meet their needs but most importantly, provide the best medical care to the patients we serve.
FMDH is well positioned to provide high-quality health care today and in the future.
There are many opportunities to branch out and do things here that one might not get or even realize are possible in a large city. Politically speaking, I just finished a term on the Board of Medical Examiners and a year and a half as their president. Probably not an opportunity I would have received if I was an anonymous person in a 300-bed hospital or 300-doctor hospital. We've had 2 previous Montana Medical Association presidents come from this hospital. All of our staff docs have been involved at the state level with their medical societies, their specialty societies. I've seen small hospitals, and this is small in numbers of beds, but it's not a small hospital in terms of skills and equipment available. While this is licensed as about a 50-bed hospital, we've had a CT scanner for 10 years. And the best that ultrasound could offer, upgraded every 2 or 3 years. Swan-Ganz capability when I arrived here in 1978. It's a really well-equipped hospital, and though the specialist backup is not a constant feature like one would have in a large hospital, the equipment availability and the expertise of our nurses makes it more like a large hospital than a 50-bed hospital. We are actually a referral center, so that there are many patients taken care of here from outlying, even more rural hospitals.
The radiology services at FMDH enhance our diagnostic capabilities.
One of the advantages of being in a small community is the fact that you get to know the physician directly on a first-name basis. And they will contact you and describe to you a problem in much greater detail in a briefer period of time than you would in a large medical center. And this reduces the number of delays, the number of inconveniences, irritations, mistakes, etc. And you actually become part of a team concept. I think this is good not only for the physician, but it's the best situation for the patients.
Mobile mammography and ultrasound testing are also offered as outreach programs in neighboring communities. Our dietitians, home health care nurses, and home oxygen delivery staff extend services to people beyond the hospital doors. FMDH specialty clinics bring specialists to Glasgow for patient care and consultation with local physicians. Physical therapy is carefully and compassionately carried out through evaluation, treatment, and training. Our physical therapists also provide professional services in the home and to patients in other communities through outreach clinics. The FMDH lab gives prompt service and accurate results. While most analyzing is done here, our relationships with dependable reference labs are well established. Women from all over the Northeast rely on FMDH to provide the very best in obstetrical care.
I would venture to say we're probably the best equipped hospital of this size in the United States. I have everything that I need to practice obstetrics and gynecology. We have state-of-the-art ultrasound. We have a state-of-the-art laboratory which services us very well. And we also have a referral system which, as I said, leads us right to the largest tertiary centers in the country. So I think we've maintained the quality as well as keeping a sort of a home-style hospital.
Constantly striving for professional improvement, our employees achieve professional goals through scholarship programs, independent study, and advanced training. The hospital's education department is a valuable resource for ongoing instruction for each hospital employee. Since we are a smaller hospital, we maximize the talents of our nurses through cross-training to several areas.
We have multiple training opportunities through our own facility and also in conjunction with national certification boards. We do ACLS, Advanced Cardiac Life Support, we do the PALS, there is a trauma course. We just have a multitude of educational opportunities. And besides being a comfortable place to be, it's a great place to learn and to provide great patient care.
The employee benefit package offered by FMDH is competitive and extends to complimentary use of the hospital's fitness center. The center also houses our cardiac rehabilitation program, where patients work to reach and maintain the highest physical and psychological level. EMS volunteers extend emergency care to all corners of Valley County. Upon entering the emergency room, patients receive professional care from nursing and medical staff. The hospital's air ambulance, a dedicated twin-engine aircraft, transports patients to or from any medical facility. FMDH is among the smallest acute care facilities in the United States to have its own air ambulance. Glasgow's low crime rate and friendly rural lifestyle make it a great place for a family. Our schools give students the opportunity to excel academically and build skills for lifelong learning. Year-round recreation opportunities are plentiful. Fort Peck Lake, known for record walleye pike and Chinook salmon, borders the 1 million acre C.M. Russell Wildlife Refuge. Glasgow's swimming pool, tennis courts, parks, country club, along with many programs available to all ages through our Civic Center, provide a varied menu for relaxation and recreation.
It's a very casual life. You don't have to worry about where you're going, who you're going with, why you're going, what you're doing. You just do it, you know, and it's wonderful to be able to live that way.
I found a very diverse mix of people, extremely interesting, well-traveled people. It's not what I thought it was going to be.
Glasgow is a hub for business and agriculture. You'll enjoy the many retail stores, service establishments, and restaurants. If your goals include a desire to provide high-quality health care while enjoying the very best traditions of life in the West, contact the Francis Mahon Deaconess Hospital today.